It is health that is the real worth and not some pieces of gold and silver. As a country, paying attention to our public health is extremely important. It's something that we need to do. But the neglect on that sector cannot be overlooked, especially in these times that COVID-19 has exposed all of us. It is important that we invest in this sector. And today we talk about investing in our health sector to deal with public health threats that might come, or to fight with public health threats that will come. And today I have a distinguished member of parliament to help us talk about it. But a lot of you have been asking, when I posted this, what is public health? So I'll give you a brief definition of what public health is. Public health is defined as the science and art of preventing disease and promoting the health of people. Public health is the fundamental for prolonging and improving quality of life, including those at the bottom of the population pyramid. So I'm sure we all get it. So to help me do the discussion, I have a ranking member of the Health Committee, and he is a member of the 7th Parliament of the 4th Republic of Ghana, and he is representing the Dwabusu constituency in the Western region, and he is going on the ticket, or he is on the ticket of the National Democratic Congress, DNDC. Honorable Kwabena Mintah Akandoh is my guest. Welcome to the show. And he's also a farmer, just so you know.
That's very important.
It's very, very important. After this, I'm sure you give us some tips. All of us, we are waiting. So welcome. It's good to have you here.
Thank you.
How's the constituency doing?
Well, the constituency is fine, except that we're confronted with some kind of disaster, I think about 2 weeks ago. So last week I had to rush there and go and give some relief items.
Wow.
I mean, roofing sheets, nails, cash, to be able to assist people to come up to life.
Wow.
But now it's okay. Communities like Asempane, Eteso, Dominable, and Bremai. But now I think everything is normal.
We thank God. We thank God everything is normal. I'm sure another time we'll have you here just to talk about your constituency, how far you've come, what next for you, what next for Dwabusu, and what next for your farming career as well. But today we're here to talk about public health. And I'm sure that in this COVID-19 corona, system, you've heard a lot of it. You've been bombarded with that term, public health, and I defined it earlier. But as ranking member, honorable, as ranking member in Parliament, maybe you would want to throw more light on it, just so we can set the premise right for the discussion.
Jackie, let me tell you, and let me thank you very much for the opportunity and commend you for choosing this particular topic. I have always been of the opinion that we must prioritize our health sector. We must prioritize our health sector, and it is everybody's responsibility to do that. Okay, if we begin to put our health issues at our front, then I believe that if we begin to interrogate the issues in the health sector, we may be having the results very soon. Okay, and so I commend you highly for taking this particular topic. For me, health is about how to survive, to live a quality life. You understand? And so, per the Abuja Declaration, we are supposed to spend not less than 15% of our national budget in the health sector.
Do we do that?
In fact, to tell you the truth, in 2020 budget, as I have it here, we are struggling to do 6%.
Wow.
Struggling, because we are doing about 5.5% of the national budget. It's very sad. And you see, as the conversation goes on, I'll be telling you some irony in the health system. Whilst we are supposed to spend more, add more into the health sector, at this point in time, we are rather siphoning money, taking money from the health sector, and that is sad. In the whole sector, the health sector, I will want to divide it into some categories.
Right.
Before you be able to have a very strong health sector, you should be looking at the human resource base. Human resource base. So as a country, any serious country will be thinking about how to start training people in the health sector, i.e. the medical doctors, the anesthetists, the nurses, the midwives, and what have you. So anything that will prevent any qualified person having access to the training, you must reduce or eliminate it completely for people to have access to the training, especially when you need them in the system. After you are done with the training and you have them, you must ensure equitable distribution of the human resource. It doesn't make sense when you have more than 700, I'm just citing examples. You have more than 700 medical doctors in Accra and you have less than 50 medical doctors in Upper West. It doesn't make sense. It's a country, so there should be equitable distribution of the human resources.
You said earlier that, not to cut you, but I don't want us to go too far from it. You said that 15% of the national budget should be allocated to the health sector, but currently we're struggling. Why is that? Why can't we dedicate us? Why can't we say that, okay, 15% is supposed to go to the health sector? Let's give it 15%, because even 15% might not be enough.
Yes, I agree with you. But you see, the executive is the holder of the public purse. They will bring the policies and will sit in parliament to approve. You understand? And so, as a member of parliament, although you may have some kind of leverage or some contributions or some input to do, but you have your limits. The only thing probably you may do, one, to disagree or to criticize the system. There are some revelations that if it comes up, it will shock you. We have something we call CAPEX, the capital expenditure. In 2020 budget, government is investing 0 Ghana cedis in CAPEX. And that is what is supposed to expand the infrastructure in the health sector. 0 Ghana cedis, government of Ghana. You understand? And so these are the issues. And in fact, if you ask me, the main challenge as far as I am concerned in the health sector is money. Money. If you ask me three things, I would say money, and money. I am telling you,
there's not enough.
It is woefully inadequate. What we invest in our health sector is woefully inadequate, and I'll come to those sectors as I develop these points. Now, I was still at the human resource base. Now, after ensuring, and before you can even ensure equitable distribution of your human resources, there should be some kind of motivational scheme.
Right.
So that if you put somebody to Draboso constituency or district, he may not say, I won't go. So there should be motivational kind of, you should be able to motivate them to take up those challenges. Because somebody will say, look, if I'm in Accra, I'll be able to upgrade myself. If I'm here, you understand. So there should be that, attempt to be able to motivate them. And after training them, motivating them, there must be that infrastructure to absorb them. So it's a holistic system. You must develop it holistically. Whilst you're encouraging more nurses to learn, doctors and what have you, when they finish their education, where are they going? We have some number of nurses in their house at the moment because of lack of infrastructure. And so that's where I am sad sometimes when governments come and they say they are not going to continue what they come to inherit. Do you understand? You know, the previous government left a lot of infrastructure in the system, especially those who were uncompleted. A lot. Today, COVID-19, we are talking about the University of Ghana Medical Center. COVID-19, we are talking about Ridge Hospital. You understand? These are major Bank of Ghana hospitals. These are major investments in the health sector. You know, for the past 5-6 years, we started on a very good note, but it's going down. You understand? We invested not less than $2 billion US dollars in the health sector. So if you go to every part of this country, you can see some kind of infrastructure coming up. You go to Kumawu, you go to Kwabena, you go to Wa, you go to Adenta, you go to police hospital, you see some kind of infrastructure. You go to every part of this country. You understand? You see some kind of infrastructure. And that is what we must sustain. And those that are completed, we have to equip them and operationalize them. If you have the infrastructure and you don't fully operationalize the infrastructure, the citizenry do not get the full benefit of the infrastructure. So, not until COVID-19, the Bank of Ghana hospital was under lock and key. It doesn't make sense. It doesn't. You understand? The University of Ghana hospital was operating under 10%. You know, so we have to complete the uncompleted ones. Some of them are as near as 80% complete. We must be able to complete them and then add more beds whilst we are absorbing our health professionals, and then we will be able to say, look, we have enough bed capacities or beds in the system, so that in case of any eventuality or crisis as we find ourselves in, we may not find ourselves wanting. Right. So the infrastructure base is very, very important. So I will always put infrastructure and logistics together. You understand? And so that is very, very important. Then we come to the financial aspect, financing. Your money. not even that aspect. I'm even looking at financing aspect, the patient, the citizen. How we'll be able to eliminate the financial barrier so that you and I will have access to quality healthcare. So it will not mean that if you don't have money, you can't go to hospital. And that is why the health insurance system came in. But unfortunately, only about 34% of the population are on the national health insurance. So here I would advocate that a lot of private ones should also come on board. And even the national health insurance has its own major challenges. So you hear service providers saying that we are drawing our services. You hear people saying that, oh, I have gone to the hospital and they have turned me down and they didn't give me drugs and all that. Why? Because the system is not efficiently run. We have a reliable source of funding for the national health insurance, but you realize that the system could be in arrears for multiple of months, 5 months, 6 months. How will the health facilities survive? How will they be able to run? You go to some health facilities and they say, look, we don't have money. They have been disconnected. They don't have water running. And these are major challenges in the system. So instead of government putting more money into the system, then government comes to parliament and say, I've brought a law. I'm supposed to cap. I'm supposed to take money. The one that is not enough. Government is taking money. And per the 2020 National Health Insurance Formula, government is taking not less than 390 million Ghana cedis in the name of capping.
But Honorable, so if you know all of this, if the health committee in parliament knows all of this, what is the duty of the health committee? What are they supposed to do?
We play oversight responsibilities. We check all laws regarding the health sector and all that. All these things I'm talking about, for example, this capping issue, for the past 3 years, consistently, we have been advocating that if anything at all, the government must exempt the health sector as far as the capping is concerned. When government says you won't listen, what can you do?
Do you think that government really do not see health sector as a major risk, or health in general as a major risk, as we didn't see COVID-19 coming? And so even building more hospitals, equipping our medical personnel, it's not really a priority to us. We didn't see it as a threat.
For me, you may disagree with me, but I don't see the actions and inactions of government. I don't see the health sector as this government's priority. That's not what I see. Because if indeed it is, you should see some kind of vigorous investment in the health sector. But that is not what is happening. Even those that they came to meet have been abandoned. You understand? For example, Jackie, how would life have been without Bank of Ghana Hospital, University of Ghana Medical Center, RAGE? The first isolation center I heard was RAGE. You understand? So what you need to do is that you have to think ahead, think out of the box, and ask yourself, 5 years, 10 years to come, how will the situation be? So you must do more. You understand? A lot of things were done. If you go to Central Region alone, in the past 5 to 6 years, there were about construction of about 10 polyclinics in the system. 10. In all, in the whole country, we have about not less than 20 polyclinics, district hospitals, health centers, check compounds alone in thousands, about 2,000 check compounds. And that is the basic. That is where you ensure that the people in the remote areas have access to at least some primary health care. So for me, I do not see that. And that is why I am highly commending you this morning for choosing this topic. How many, had it not been even COVID-19, how many of our platforms have we dedicated to our health sector? Are we thinking about, probably you think that you are in Accra, so you have access to wage and what have you, but are you thinking about your relatives in the villages? How are they surviving? You can have all systems and all structures in place. When the outbreak came, we are relying wholly on the health professionals and our health facilities.
Frontliners.
I mean, you know, so for me, I think that we must begin to interrogate the issues. We must begin to criticize and scrutinize the sector, and that is where I think that we may begin to have the results we desire. Right. But as we speak now, my sister, I am afraid, and I do not intend creating any fear and panic, but then ask yourself, if Dr. Nsiasare is projecting that it is likely that we lose not less than 15,000 people, you ask yourself, how many beds do we have in this country? 15,000. What's the time period? How are we going to take care of them? So there is an emerging disaster.
So my question is, what is government expected to do? What is government expected to do to better our public health sector, to better our health sector in the country?
Invest money. Inject money into the sector. Because if you are bringing budget to Parliament and a whole regional health directorate, for a year, the budget to the whole regional directorate is less than 7,000 Ghana cedis. What are they going to use it for? A whole regional directorate. 7,000. You heard me right. 7,000. I have all the figures here. What are they going to use the money for? So there wouldn't be that effective monitoring of the system. Anybody and everybody will be doing what he or she likes. You know, so for me, what government needs to do is actually, we should not be pretending. If you pretend in the health sector, COVID-19 will come and expose you badly. Other diseases like COVID-19 will expose you badly. Over the years, I have always, and I think that probably some of you have been seeing me, I've been going around visiting the uncompleted health facilities. I went to a Bank of Ghana. They prevented me from entering the facility. I was insisting that, look, this hospital must be open. They didn't open. Hasn't COVID-19 forced them to open it? It's been open now.
Why didn't they open it? Or why are we holding on to it?
I don't know. And nobody can convince me why Why have they opened it now? Why have they opened it now? You know, so these are the challenges. These are the challenges. Sometimes for me, I believe that if you rather continue an uncompleted project, whether you started or not, it's a mark of maturity.
Would you continue if the terms had changed, or if hands had changed and you were now there and it was the other way around?
Why not? I will add. You see, the money is not for His Excellency the former President Kufuor or Professor Mills or for Jerry Rawlings, or for the money is for the good people of Ghana. So if you lock that money there, whether it's a loan or it's internally generated, you will never get the full benefit of that money until that facility is put to good use.
Right.
You understand? So let us try to encourage, and at this point, let me salute our health professionals, especially in the wake of this crisis, availing themselves. Some of them are working under some bizarre circumstances, very, very, very limited or inadequate PPEs. And look, this thing, we have been talking about it. Yesterday, I listened to the presidential advisor on health, and he was asked a question: how many PPEs or kits, test kits, have you bought? Struggling to answer. And I was shaking my head. He was able to tell us how much Jack Ma brought, but he couldn't tell us. What are we hiding? And in the health sector, you should not hide. If you have nothing to fear, you don't have anything to hide. It is for all of us.
All of us.
And sometimes, you see, when this issue broke out, though I was defeated at the committee level, I was of the opinion that they should do full disclosure of people who test positive. That was my position. Other superior argument came that, look, ethical wise and stigma. But you know why the stigma came in? It is because we started hiding it in the initial stages. Why are they not stigmatizing them in the US or in UK? Because it was
open.
Do you understand? And look, because we do not, for me, for example, those who have tested positive, if I had ever come into contact with any of them, I do not know now because I don't know them. So if I know them, I'll quickly go and do what? And go and check. I know you are checking your time, but to wind up, Jackie, for me, in my humble opinion, the way we are handling this COVID-19 issues is not the best. And I still insist. And I started crying not today. I started inviting the president to even give a comment, and he never did until 11th March. Now, they've lifted the lockdown. And I'm saying,
good or bad?
I'm saying to anybody listening to us this morning that it is more dangerous now to go out than ever.
Right.
For me, I've been trying to interrogate the science behind, because the president told us that that decision was backed by science. I've been struggling to interrogate the science behind it, and I'm not seeing any science, because the science should be in the figures. That's where the science should be. For example, when we're locking down, the recorded cases were less than 100. We locked down. We locked Ashanti region down with less than 20 cases. And nobody should deceive himself. I heard some ministers saying that the numbers are not important. Why didn't you lock Gaboso and leave Greater Accra? Because we had not recorded any case. The numbers are important. And there are clear standard reasons why we lock down.
Right.
Why? To restrict the spread of the virus, to contain and combat it. When you lock down, we had only 2 regions. In the course of lockdown, we have 10 regions. What does it mean? The virus is still spreading.
We need to watch.
Do that make sense? Now, when you were locked down, you had less than 100 cases. And look at the rate at which the figures were changing. From 100, it moves to 200, it moves to 300, 400, 500, 600, 800, from 800 to 1,000. So the curve is still increasing. And as Kwabena himself told the whole country that, look, be at ease. We will see the numbers going up. At a point in time, it will flatten. What does it mean? It will remain constant at the peak. When it remains constant, it will start dropping. Has it remained constant? Is it dropping? And you say you have lifted the lockdown. You say the numbers don't matter. You say it is not because of the numbers we locked down. Then it's because of what?
So what would be your advice to the general public,
on
COVID-19?
On COVID-19. Let's take our precautionary measures seriously. Wash your hands regularly. Use your hand sanitizers. Ensure social distancing. And what is missing and lacking in the education is the reasons behind the precautionary measures. If you're able to tell the Ghanaian why he or she must do that, he takes it more serious than just chew and pour like you do. If you are taught in class and you understand it, it is better than chew and pour. You understand?
I get it.
Why are we saying we should ensure
that you wash your hands?
The reasons are, look, science follows logic. The reasons are simple. You know, sometimes inadvertently you touch your face with your
hands,
and we use our hands to touch almost surfaces. So it is possible you have the virus in your and you touch your face with the virus. There's an opening here, some receptacles here, there's an opening here, there's an opening here. Don't forget, if you apply some medicines here, it comes into your throat. So the virus gets there, okay, and when the virus gets there, why is it that they say, oh, drink more water? Okay, the reason behind it is that in the throat, when you drink the water, it gets to the throat, and then there are 2 holes, the trachea and the esophagus. They don't go, they lie at the same place, they go separate ways. But when you drink the water, it goes through the esophagus and not through the trachea. So when there's the virus in it, the water could, I'm using my words advisedly, could push it through the esophagus. When it gets into your stomach, the hydrogen chloride there may kill it. Okay, but when it gets into the trachea, it goes to attack the lungs.
Right.
So when the Ghanaian, the person knows this, he understands. This is not rocket science.
It's basic.
It's basic. So when you sanitize your palm, it is possible that even if you forget and you touch your face, your palm or your hand may not be contaminated. Right. You understand? And then we have come to realize that there's no vaccine, there's no cure. Yes. So what do? We need to boost our immune system. What do we mean by that? There are some antibodies that fight. You see, we come across diseases all the time. All the time. It is because when your antibodies overcome the disease, you don't show the signs of the disease and you don't force it. You understand? And so when you are boosting your immune system, what do? You eat well. You take more fruit. you eat more vegetables, you drink more water, you rest. So you may have the virus, but your immune system may be able to fight the virus without you showing symptoms. So let us take this education. And you say, what basic thing government must do for engaging the public on TV and radio? Yes, they have done well. I must give it to them. But we have left the communities, the grassroots. Instead of us to resource the NCCE to go to the grassroots and engage them in education in our various languages, we are not doing it.
Right. I'm sure you wrap up with that. You will say it in Joabusu language so that before we go. But the new cases that just came in, 1,154 new cases, 120 recoveries, thankfully. So 1,154 new cases. So finally, on investing in the health sector, you've said that government must pump in money. They must do more. And I'm glad that you said that, because a lot of people...
Before you continue from there.
Okay.
We should, as much as possible, limit, if not to avoid, partisan political interference in the health sector. I beg you, I don't want to go further. Political
interference in the health sector, let's avoid it. And I'm happy you said in the beginning that it's not just about big hospitals, because it's a myth. Some people think that once we have big hospitals, then we have a good health sector. I'm glad you said that. We need to get logistics, get the hospitals, get consumables, get even our doctors and all of it on point. We need all of these things to come together to help the sector. Thank you so much for coming. But before you go, there was a story on Al Jazeera, and I'll briefly, you're still a farmer, so I'll just make you comment on it. Al Jazeera, according to Al Jazeera, global hunger could double due to coronavirus pandemic, and that's what they're saying. So this is affecting farming, and so you as a policy maker, what is Ghana doing to avoid farming, hunger in Ghana?
Sometimes when you talk and people think that they know it all and they don't listen, you see, nobody is a repository of knowledge. And in governance, you must be tolerant. Listen to divergent opinion. If there's any opportunity to invest more in the agriculture, it should be now. This is basic. You know that we import a lot of our foods into this country, especially rice. My sister, we have no reason importing rice into this country. So now, there's not going to be that much import in the country. So what you do is that the Minister of Agri must come out with some policies, and then they must be on the field, encouraging more farmers. In any case, when you go to the farm, as for the farm, social distancing is compulsory. Because it's a life. For example, if you are on a 1 hectare, even 1 hectare land, and you are working, everybody will be. So social distancing is compulsory. So there should be that deliberate attempt to invest more in the agri sector, so that we'll be able to grow our own food. We consume rice than any other food in this country.
That's true.
And we have the land. It's not as if we don't have it. So what are we waiting for? Nobody's doing anything.
Honorable, I'll definitely have you here maybe next week to talk about just this topic, because this is a whole topic on its own. I'm sure you can tell us the percentage of the budget that goes into agriculture as well. I'll definitely have you here.
Don't let me assume the position of a ranking member on agri as well.
Of you here, don't worry. But thank you so much, Honorable Kwabena Mintah Akandoh. It's been good, and he's a member of parliament for Joabusu constituency in the Western region. Thank you so much for coming. Into Ubaka or answer yako.
If I'm speaking that, I was saying me come session. If I'm speaking
that,
Ebiela boye oniame ene njremoye. Miss Roche ekunzi wosa. Ekofa hansa nzala ko pawsen. Afeko so ne ka bia boye mini apeme won neta akobre se suna pinjewa ayate won ka didiye na nunzu so pembe
beautiful, eat well. That's all I had. Didiye, eat well. Thank you so much, Honorable, and thank you so much for watching.